Hi, welcome and thank you for joining us today. Today we'll be talking about interceptive orthodontics and how and why it's necessary for your child to come in to screen for problems and issues that they have with their teeth and their bite. With me today is Dr. Arvinda. She's joined us here at Dr. Face and Jaw and White Smile. She's trained in the University of Liverpool and she's a specialist orthodontist registered with the Malaysian Dental Council.
Thank you, Doctor. And I'd like to introduce Dr. Ruben, who is registered with not only the Malaysian Dental Council but also the Australian Dental Council as well. So what exactly is interceptive orthodontics? So it's all about detecting problems earlier on in children as early as the age of 7 up until 12. When we intervene earlier, we can prevent more severe problems from developing earlier on.
This can also positively impact the way the jaw and face develops, and it can also prevent more severe issues from worsening later on. Newer digital tools help to refine our capability to intercept and correct these alignment issues, as well as potentially the way that the jaws and the face develop.
As children grow, their jaws and teeth are still developing. Interceptive orthodontics takes advantage of this growth and guides teeth into their proper positions, ensuring a harmonious bite. We have digital tools at Face and Jaw that help us control not only the teeth but their root positions like never before.
Prior jaw and face treatment were excellent at creating space, much like building or expanding a larger home to create space for teeth. But these days, additional proper staging and positioning of existing adult teeth allow for the remainder of the permanent teeth to emerge successfully. This is called broadband staging. So here's a short schematic of normal tooth development. The front teeth are out, the adult teeth that is, and you can see how the adult teeth guide the ones which are still developing to emerge properly in the mouth. And we can reproduce this and accommodate for this in our treatment.
Here we have a child with a blocked out lower right canine. As you can see from the photos on the screen, the tooth is trapped beneath the gum. And on the X-ray that has been superimposed on the photograph, you can see how it has absolutely no room to come through. And now what we're going to do next will show you how we have intercepted this problem and made room for the canine to come through.
So we use a removable clear aligner to gently guide the re-expansion of space for the blocked out adult tooth and to gently push the other teeth into their proper positions.
Here in the photographs you have on screen, you can see that after the course of removable clear aligners, we have made enough room for the canine that was trapped to emerge into the mouth. This has not only alleviated that problem but also ensured that the child has a healthier bite and will avoid severe treatment later on in life. And now we have an example of a child with a similar problem but no action was taken here. So as you can see, the child has now been left with a tooth that was stuck outside the arch on the right side.
So by addressing issues early on, as you can see from the previous example, we can often avoid the need for more extensive orthodontic treatment later on in life. This process is called growth modification. But now let's talk about some common issues that this sort of treatment called interceptive orthodontics can address. One of the most prevalent is crowding, when there just isn't enough room in the mouth for all of the teeth to come in properly. They appear jumbled up. To alleviate crowding, we use a variety of either fixed or removable therapies such as clear aligners or white smile clear aligners to achieve our treatment results.
So moving on to another scenario, here we have a child with teeth that are jumbled up together, so they've not come out in the correct positions. Yeah. So we will provide a series of clear aligners again for this patient to unjumble their teeth and to align them into its proper position. So here's a simulation of how we are able to do so.
So the clear aligners are pushing the teeth into position. Here we've used white smile clear aligners, but there are a variety of clear aligners that can do that. And you can see the movement of the teeth appear on the simulation, and this will push the teeth clinically in the patient's mouth into the right position.
So here you can clearly see the before and after the same patient. We have unjumbled the teeth early, and the rest of the adult dentition is coming through normally, which is just
what we want, really. Yeah, it's nice.